Peace be to you all. Assalamu alaikum. Omar Abdul-Malik, physician assistant, doctor of health education, moderately fit, middle-aged athlete, and family man here. So I wanted to first say happy PA week. It runs from October 6th to October 12th. So for those of you guys who are pre-PA students, or physician assistants, sometimes called physician associates, happy PA week to you. I want to talk about the future of PAs in this country and in the world. Right now, if you follow healthcare news, there seems to be a dynamic that's going on in the United Kingdom with NHS, so the National Health Service, I think it's called. I could be wrong. Correct me in the comments if I'm wrong. But that's the agency or the service that renders service to the populace. So there is this I don't want to call it a conflict, a kind of a controversy with physician associates taking over positions that medical doctors used to be in. And I think that's coming here to the U.S. because our healthcare system is absolutely overwhelmed. You can't replace a doctor in enough time that doctors are retiring. You can't replace them at the rate that doctors are retiring. Many of the medical doctors who trained me are either retired or dead. I was just talking to one of my erstwhile supervising physicians. He's in his 70s now. He said, a lot of us are retired or dead now. So it takes about 15 years of training just for an ambitious 18-year-old high school graduate to finally become a doctor. And that's just an internist who maybe did a year or two of fellowship for specialty. So it takes a long time and it's very expensive. And a lot of young folks, the millennials, are choosing to make their money outside of the healthcare field. They're going into computers and different internet personalities, and they're making a lot more money, certainly garnering more fame than any medical doctors do or would. But we have a growing population also. When the physician assistant, I think back then they were called physician's assistant, when they were first created, when the field was first created at Duke University back in the 1960s, the first class graduated, I think, in 1967. That was under Dr. Eugene Stead. Well, back then the population was about 200 million people, just under that. So fast forward to 2024, now it's about, I think, 345 million. I think I meant 200 million. I hope I didn't misspeak. But this is back in 1967. There were about 200 million Americans. But now there are about 345 million Americans. And that number is certainly expected to grow. We have a growing population of aged people. I'm going to be one of them in a few years. I'm 56 now. I will be a bona fide senior citizen, if I'm still alive, inshallah, in the next few years. I don't plan on working till I'm dead, so I'll be a retired person. I'm already getting mail from the Association of Retired Persons. So who's going to replace me as a PA is my age group. Us aging Generation Xers start to retire and die. That's going to be very difficult for doctors to replace, and even those of us that are PAs. So I think PAs can really help kind of fill the void where their doctors are overwhelmed. I think that our training is going to change in the future. There's talk of making the doctorate the terminal degree for physician assistants. I don't know if I'm a big advocate of that, but it's inevitable. I mean, it happened. You used to just be able to have a certificate as a PA, then it became an associate's degree, then a bachelor's degree, and now it's a master's degree. You have to have a master's degree in order to be a PA in most cases, and certainly be certified. And the training, I think, has become a lot more intense. There's more that's expected of us as PAs. I'm so impressed by the new generation of PAs that are coming out. They know how to do so many different things, and they're trained on computers, so they're very adept at using the electronic medical records. And there's new technologies out, and even new diseases. I mean, look what COVID brought about. New ways of looking at diseases in different fields of medicine, things like epidemiology. So you're going to see PAs branching out. Now, that's not without its foibles. There's a more vociferous group of PAs that want more autonomy than we have already. I'm not a big proponent of that. I think that what we have now is fine. I think that we as PAs should work in conjunction with our supervising physicians, and we should work under them. That doesn't speak ill of us or say that we don't know what we're doing, but we simply don't, quantitatively speaking, we simply do not have the training of a medical doctor. And I say this as somebody who's been a physician, a licensed physician assistant for almost 25 years, and has held leadership positions. I've published research, I've taught, I've done a lot of things. I've been a clinical coordinator. So I've been very blessed and fortunate in this profession. It's been good to me, and I like to think that I've been good to it. And I've been able to save quite a few lives, or at least improve upon the quality of people's lives. And for that, I'm very humble. And I'm grateful to my colleagues, and certainly my supervising physicians. So I think you have to have a dynamic that works for our field. I don't want to speak about other fields. I'm ignorant of the training of nurse practitioners, for instance. I'm hoping to interview some for this channel, Lord willing, inshallah. But that's it for now. I think this is going to remain a very robust field, the PA field, or certainly medicine is a robust field, but I think the PA career will remain very robust. It's going to grow. Our technologies are going to grow. Our training is going to certainly grow, and more is going to be expected of us. I don't know how this is going to change the dynamic between PAs, medical doctors, and nurse practitioners. I hope that it works out for the greatest good. I want what's best for my fellow man and woman. I really think that we need to keep the well-being of our patients at the foremost, front and center. When we're deciding what we're going to do and what powers, quote unquote, we may have. But that's it for now. If you want to be a PA like me, know that it takes a master's degree, so you've got to get a 4-year undergraduate degree. I would suggest something in the sciences where you're covering all of the prerequisites. That's very heavy into life sciences, so biology, then there's chemistry, organic chemistry, microbiology, biochemistry, that kind of thing. Have a very good GPA, competitive GPA being about a 3.5. Take the GREs and hopefully get that interview, get your direct points, your direct contact hours with just seeing patients. I would suggest something like nursing assistant or phlebotomist. And, hopefully you'll get into school and do your 2 years, 1 year of didactic, 1 year of clerkship, pass your physician assistant national certification exam, and get your license and get to work. But and make that 6-figure salary that everybody talks about. But that's it for now, guys. Feel free to contact me. I'm available for mentoring students. All right. I wish you guys the best of success in your positive endeavors. Peace.